Everyone, welcome back to the channel. In this video, I'm going to be discussing with you about vaginal discharge during pregnancy. I've got some notes here, so if you see me looking away from the camera, it's because I'm looking at the notes to make sure that I cover everything for you in this video. During your pregnancy, it's very normal for you to get increase in your vaginal discharge. It's very important that you are aware of your discharge, so you will know what is normal and what is not normal for you. Everybody is different, so it's very important that you are monitoring yourself. And if you feel like something is not right or something is out of the blue or not normal for you, then you are able to recognize it and see a doctor's for some advice and some care. What makes vaginal discharge is the level of estrogen hormones that increases during your pregnancy. Your vaginal discharge is made of vaginal fluids as well as some cells. It's very normal and it's very common, and most women will experience an increase. What is a normal discharge in pregnancy? A normal discharge that is not concerning should be white in color, milky in color, and of course, sometimes slightly light yellowish in color. The odor of your vaginal discharge should not be very smelly. It shouldn't smell of any offensive smell or a fishy smell. Okay, it should have a very normal smell, nothing unpleasant, and it's okay. What is not normal is for you to feel like, or for you to smell a fishy smell that is just really offensive, and you know it doesn't smell very pleasant. This is not normal. I will discuss more about it as we go on in the video. The reason why you're going to have a vaginal discharge increase is there in order to protect the vaginal area, to make sure that there is no infections happening in the area, and of course to make sure that you have an amount that will be able to form your mucus plug for the pregnancy. This mucus plug is what's going to protect your baby during the pregnancy from any outside infections. The reason why you're also going to get more discharge in your pregnancy is because of all the increased blood volume that goes towards the pelvic area. This is very normal. So the different types of colors, as I said, that you're going to be seeing in your discharge, it should be milky looking colored, it should be white, it could be also light yellow, and not offensive smell. The consistency can be either be thick, thin, or a little bit clotted. Okay. Now, if you see a clotted discharge, it doesn't mean that there is an infection. Of course, some clotted discharge will indicate that there is an infection, but I'll go through that as well. But it's normal for you to have discharge that is thick or thin or a little bit clotted, and that's okay as well. The odor of your discharge should be pleasant. It should not be offensive. It should not be a fishy-like smell. It shouldn't be anything that is unpleasant to yourself or to anybody else, such as your partner. And if it is, then you may want to start thinking about getting to see your physician or your midwife or seeing your GP to make sure that they're doing the test, to make sure that there is no any infection. And if, of course, if there is an infection, they can see to it that it's treated in a timely manner, so it's not lingering around causing more problems. You can have some discharge that will indicate that there is some form of an infection. I'm going to go through this step by step. So the most common infection that you can get during your pregnancy, which will show in the discharge that you're getting, is called a yeast infection. Now, if you are experiencing a yeast infection in your pregnancy, the discharge you're going to be getting will be white, clumpy, okay, clumpy, similar to a little bit like a cottage cheese. It will have some either maybe an offensive smell or some type of a scent that you know is not normal. You're also going to be experiencing some itchiness down below in the vagina, and this will possibly indicate that there is a yeast infection that you are battling. If this is what you're facing, please see your GP and speak to them about your symptoms, and they'll be able to give you more support and more guidance as to what to do to treat the infection that you're experiencing. Another infection that you can also get is called bacteria vaginosis. This is also known as a BV infection. Now, with this, you're going to be having a thin discharge, very liquidy. It's going to be a bit of a grayish in color. It could also have a very, very offensive smell and a bit of a fishy smell that you know doesn't smell right. Okay, you are going to be smelling it either with your clothes on or without clothes on, and you will know that it doesn't smell right. It doesn't, it's just not, it's a very offensive smell. So therefore, you know you need to seek some advice and get this treated as soon as possible. There are, of course, also sexual transmitted infections that you can get during the pregnancy that will indicate in your vaginal discharge as well. Please, if you are unsure or worried that you might be at risk of any sexual intercourse infections, then please seek your advice from your GP or sexual health clinic for some tests that can be done immediately to, check and rule out any infection or to diagnose any infection in order for treatment to start. In your first trimester, you may experience a different type of discharge compared to your second trimester and your third trimester. Okay, in your first trimester, you're going to be experiencing discharges such as really thin, very liquidy, and you're going to have definitely more increase. It can sometimes to also be very thick, a little bit of a stretchy, a little bit of a see-through type color, but very stretchy, just like you would when you're experiencing your ovulation time. And this is normal. During your second trimester, it's important to also note that you will continue to have more increase in your vaginal discharge, and this is okay. The color again will be creamy, it will be white or milky colored. It will be nothing offensive in smells, and the odor of it will not be anything that you can smell outside of your clothes or even with your clothes off, and this is very normal. In your third trimester, you will experience more and more increase in your discharge. At this point, it could be quite thick in the texture, and you can also sometimes have some liquidy discharge as well. Sometimes some people will confuse this, or if waters are going to break or waters do break, you may confuse your water breaking with discharge. Now, the way to differentiate between waters breaking and a discharge is to make sure that you put on a pad and you become aware of what is happening down below. So if there's a water that's broken, you will find that it continues to come. So you're continuously wet. If you put on a panty liner or pad, you will find that you're still continuing to be wet. And if it is just a discharge, you put on a pad, you will come back and you find that actually there's nothing there at all and you are now absolutely dry. So you will know the difference, okay? Another thing to consider is, of course, what you can do to help yourself in avoiding or dealing with increased discharge during your pregnancy. The first thing you can do is to wear suitable underwear, such as a cotton breathable underwears. You can also try using some pads and some panty liners to give you more comfortability and to help you with any infection. Also, what you can do is to stay hydrated to help you to keep well and healthy overall. And of course, to eat a healthy, balanced diet. It's very important that you eat well. You watch the acidity in your foods, which can sometimes irritate your flora in the vaginal area. If you found this video useful, then please consider subscribing to the channel. Turn on your notification bell so you know when I come live every Friday. And of course, when I post another video. And if you feel like you know anybody that will benefit from the information in this video, then please share the video to them so they can also learn something. And I do come live on Fridays evenings between 8:30 and 9 o'clock UK time, just to talk about anything to do with pregnancy, birth, labor, maternity, all things like that. Please do join me so you can be able to ask your questions live with me. Thank you so much for watching again, and I'll see you in the next one. Bye.